just love working with people and making sure that they can be as independent as possible and bringing joy to their lives. I'm an occupational therapist and I work for a company called Allied Aged Care. So we have occupational therapists, physiotherapists. We work predominantly in aged care, but we also work out in the community. So with people of all ages, all abilities, making sure they can do everything they need to, want to and should be doing.
We work with many different professionals. We get to work closely with the community, so our patients and participants really add a big feature to our day. And it's important that the work we do really changes the way healthcare can look and feel into the future by providing new solutions to different diseases, chronic conditions or even some terminal conditions.
In Australia, 1 in 4 people will experience a mental illness of some form in their lifetime. So there is a specific need for an increase in mental health services nationwide. On the Sunshine Coast, our suicide rates are higher than the national average, which means there is a gap in the system, requiring more services and more people to engage in those services as well. So I work at the Sunshine Coast Mind and Neuroscience Thomson Institute as the operations manager. The Thomson Institute is about providing services and research studies for the community. We follow a care model, which is around clinical services, advocacy, research and education.
So we work in clinical trials. This is a global industry, an industry that's based on putting together quite a few strong professions in science, nursing and medicine. Our industry tests new medicines and new medical devices, so we're providing the solution to bring new therapies into the community.
So healthcare in general, I think, is an industry that is growing quite a lot, and especially for us in aged care with Australia's ageing population, we do, our job opportunities are expanding all of the time. You can work as an occupational therapist anywhere in the world, which is great, and with a Bachelor of Occupational Therapy you can go anywhere.
Well, the interesting thing that we're seeing is that there's always huge demand in the clinical trials industry, so we're seeing a shortage of experts and professionals coming into our industry. There's been a trend to actually find people from overseas and bring them into Australia, whereas I think what we should be doing is looking locally to try and create stronger pathways from graduates to see the merits of our industry and to apply to work with us.
The Thomson Institute hosts the Masters in Psychology program. The clinic itself is run by our Masters in Psychology students, and it's only possible because of these student placements. It's a really critical service that is provided to the community, and it removes the barriers in help-seeking behaviour, as it allows this service to be free of charge and accessible to anyone in our Sunshine Coast region.
Clinical trials is a global industry. I think if you develop the skill set, the competencies in Australia within clinical trials, you can quite easily find gainful employment if you go interstate or internationally. And it's an industry that remunerates really well because it's a high net worth industry developing new drugs and new medical devices. Employees come from a science, nursing, paramedicine and medical degree. What we're doing slightly differently is we are taking people from a business and marketing approach as well, which helps, I guess, build our ability to communicate the work we do to the community. So we offer, at the moment it's a few months of work experience opportunities, but in the next 2 years we'd love to see a 12-month internship that's paid for students.
USC graduates get a lot of experience as students. You get to start out with your placements for OT, for example, really early on. You get to learn how it all works. You get that experience as a student. You carry that through as a new graduate. I am a USC graduate. We've got about, I think, 4 other OT girls in our team as well that are from USC, ranging from new grads through to me, who I've got a couple of years experience, and our other OTs are from elsewhere, but hey.